morning to all. I'm here to present a case of syphilitic chorioretinitis. So we had a patient, a 41-year-old male, who had a defective vision in the right eye for the past 10 days. It was sudden, painless and progressive. He also gave a history of right-sided hearing loss. However, there were no history of trauma, flashes or floaters. He was a driver by occupation. And on examination, we found an 2+ cells in the anterior chamber and 2+ cells in the anterior vitreous phase. The fundus examination revealed bilateral multiple yellowish choroidal patches and a neurosensory retinal detachment in the right eye in the infratemporal quadrant, which also involved the macula. So we proceeded with an FFA which showed an optic disc leak and an early hypofluorescence along with pinpoint hyperfluorescences which suggested a starry sky pattern. However, the peripheral retina was normal. So we proceeded with a blood investigation which showed a positive VDRL and a Treponema pallidum hemagglutination assay. The patient was referred to the physician where he was treated with benzyl penicillin 3 million units 4th hourly for 10 days, and the follow-up visits showed a settled retinal detachment. So coming to the discussion, syphilis is caused by a spirochete Treponema pallidum. In adults, it's usually sexually acquired. The primary syphilis involves a chancre in the genitalia and the anus, and the secondary involves a maculopapular rash and systemic features. However, the tertiary has a cardiovascular manifestation and gummatous infiltration of the bone and the viscera. In the eye, it can cause anterior uveitis, chorioretinitis, acute syphilitic posterior placoid chorioretinopathy in our case, and it can cause retinitis. It can even cause optic neuritis and neuroretinitis. So I just wanted to report this case for its rarity and to re-emphasize on the emergence of syphilis.
You have a lot of time left. You can go on. Anyways,
that's it, sir.
Nice to present this. There are two things I need to ask.
Yes,
First, the ESR was not raised in your examination.
Yes,
so it was of course it was an active disease.
Yes, sir.
So did you do anything else to know that whether it was active or not? Any other test?
So we repeated a total count as such.
And could you stage the syphilis, the systemic illness of the disease?
Yes, sir. It's a
Was there any other
neurosyphilis.
feature apart from eye?
No, sir. The patient did not have any other feature. He had a hearing loss in the right ear. So we thought the tertiary syphilis kind of neurosyphilis. No, sir. No, it was not. We should have done it. So since VDRL and TPHA was positive, we proceeded with the yes, sir. No, sir.
So how? Sorry, you go on.
Did this subside without any steroids at all?
No, sir. We didn't give any steroids. Only with antibiotics.
Okay. Okay.
Thank you,
Good.
sir.
Thank you.